All right, Commissioner Skaczynski, we are live.
Thank you, Shannon. Welcome, everybody. Good morning. Today, we've asked that our hospitals give us an update on where they are at relative to the COVID issue, but also then to kind of telling us where we might be going if we continue having some issues with COVID. Here in Lucas County and in the region, we are so lucky to have exceptional healthcare from 4 different hospital systems. I cannot say enough about how they've done just an amazing job during this COVID issue over the last 7-8 months. They continue to just make us all very proud. And again, without them, we could never be able to respond to COVID in the manner that we have and take on so many different issues head on. Again, I cannot say enough about all of our healthcare systems in Lucas County. And again, we should all be very proud and thankful that we have amazing individuals, amazing healthcare systems in Lucas County. I want to introduce our guests today for our panel. We're going to take some time today and probably go into some detail. And so it was very important to, again, add in as many of our panelists as we can from these hospital systems. So we have today Jill Trozin, the VP from Patient Care Services, Chief of Nursing Officer, Claren St. Luke's. We also have today Dr. Kevin Casey, Chief Clinical Officer, Mercy Health at Toledo, Dr. Michael Ellis, Chief Medical Officer, University of Toledo Medical Center, and Dr. Brian Kaminsky, VP of Patient Safety and Quality from ProMedica. And also today, we have our Medical Director for the Toledo County Health Department, Dr. Dan Cadigan. I'm going to start this off, and then I really want to get to our panelists because they have some really great information to share and also give the community a perspective of where we're going and what we need to do. First off, we have really been dealing with an immense amount of COVID issues over the last 2 weeks. We continue to see our cases rise. You hear the governor, we're in the red category again. Several counties in Ohio are actually approaching purple. And again, that is significant. And there are some things that, again, we can do to not get to purple, but it is really up to us to be able to do those things and want to do those things to again, protect our community. We've seen these ebbs and flow with our cases. You saw back in July, we had a significant increase after the 4th of July holiday. We came down. We came down to a point where we were very comfortable, and I think we all became a little complacent in what we were going to do as individuals. And so again, I think it's really important historically to look at that. We were able to beat that last spike because we really did some things in our community to make sure that we reduced the ability for COVID to be transmitted from person to person. Current trends right now, we are seeing, again, significant increase in COVID in our community. Nothing like some of the rural counties or other counties are seeing, but that doesn't mean that we cannot get to those points if we don't do the things we need to do individually to, again, combat COVID in our community. We are seeing an increase in that age group. We were lower in age groups, high 20s, low 30s several months ago for the preponderance of individuals who were infected with COVID. We're seeing an upcreep to now the low 40s. And again, we understand with age comes increased issues with COVID possibly. So again, we're fighting hard to make sure that our community does all it can to not affect those individuals, those age groups, those individuals who are immunocompromised that could severely be impacted with COVID. With that said, I really want to get to the meat of the talk today. So I'm going to first introduce Dr. Kaminsky from ProMedica. He has some really interesting points that he wants to present. And so I look forward to hearing from Dr. Kaminsky. Dr. Kaminsky.
All right, thank you, Eric, and thanks to all the other representatives from the healthcare system. We appreciate the support that we get from the county health department. We appreciate the collaborative efforts that we've had with the other healthcare systems in the community. I'm going to talk a little bit about the historical perspective of COVID and what we've done as a healthcare organization. So if you all remember back, it seems like a really long time ago, but it's actually less than 8 months ago that in March we had our first COVID case. So COVID really started out as a rumor, this disease that was out there. It was in other areas of the world. It was in other parts of the country. And then on March 9th, we had our first Ohio case. And then on March 14th, we had our first case in Lucas County. And it's literally amazing to think in the period of less than 8 months, we now have over 200,000 cases in the state of Ohio. Lucas County has about 8,500 cases. We've had over 18,000 hospitalizations across the state and almost 1,000 in Lucas County. Unfortunately, we've had about 5,000 deaths in the state and close to 400 deaths in Lucas County. It's also important to point out that, although this disease causes hospitalizations and minor illness in some people and in the worst case scenario, death, there are also a portion of people that end up being called long haulers, these people who survive COVID but go on to have symptoms for weeks and months after the disease. We're still learning more about that group and learning how to most effectively manage and treat that group. So you can see that the impact is widespread. Now, one of the things that we get asked often is what kind of impact COVID has had in our hospitals in the local community. And I think it's really first important to point out that by far and away our most important asset within our hospitals is our workforce. So it's everybody. It's not just the physicians. It's not just the nurses. It's our environmental services workers. It's our dietary workers. It's our facilities workers. It's everybody that helps keep the organization functioning on a regular basis. And we rely on everybody working together to make this all come together so that we can provide safe and effective care to the community that we serve. Everybody seems to know about the physical limitations that we've had, the resource limitations with PPE and some other things. We've had to make actual physical modifications to our hospitals. We've had to change rooms and create negative airflow rooms so that we're bringing airflow out of the rooms and patients that either have or potentially have COVID. We've had to structure different waiting areas to separate people and adhere to the social distancing that's required. But really the most important impact that this has had is, again, to our workforce. So a lot of our focus has been on the physical and emotional and psychological needs of our healthcare workforce so that we can keep people working and healthy and engaged in the profession so that they can continue to serve people who are in need. Some of the things that we've done to help support and inform our community. So our community means not only our patients, but people who are out there in the community. And our community also includes our own employees and our own workforce. So we've done a number of different things. We've responded literally to every media request that we've had in order to get relevant and factual information out there to people that they can act on and have a good understanding of what's happening. And that implies internally as well as externally. So we've created bulletins that at the height of the pandemic, we were releasing on a daily basis to adjust accordingly to the rapidly changing information that was out there so that our employees and our providers had the most actionable information to use in the daily work that they do. We've also created links within our intranet, so our local internal webpage as well as our external webpage, so that community members as well as employees can continue to be current on information. And those links are and have been updated to reflect current and relevant information. There are other things that we've done outside of just informing and educating to support our community and support our workforce. We've recognized that a lot of children are home from school and that we need to continue to allow our workforce to continue to provide care. So we've established daycare programs for our employees who have children who are out of school at home and need care. We also set up an employee compassion fund because we realize that there are people in more need than others. So, we literally had thousands of dollars donated internally that we were able to distribute to applicants within our system that had the greatest need. We've also provided virtual stress management and employee assistance to those people in need who are feeling the stresses of COVID, because we realize that those are the important things that contribute to well-being and health of our staff that need to be there for the community. It's also important to point out how appreciative we are of the community. So in the beginning and at the height of the pandemic, the community stepped up in an extraordinary way to do a number of different things that help support our hospitals. So many of you saw the people who were making masks at home, the meals that were provided. There were prayers in parking lots conducted. The small businesses stepped up at their own expense to provide additional PPE and provide innovative solutions to PPE needs that we had that were ongoing. We can't thank the community and the community partners enough for contributing in that way. When we review our response to COVID in light of this second wave that we're starting to see right now, it's important for us to recognize those things that worked and those things that didn't. So early on in the process, even back in January, before we had our first case in the United States and our first case in Ohio, we established an incident management team. And that team was effective in dealing with this rapidly changing information and actually creating operational pathways and protocols and getting our arms around testing and PPE and all these other things that we had to adjust to in order to be able to provide care. So the incident management team played a huge role in us being effective and operational throughout the pandemic. We also decided, as you all know, to dedicate a COVID hospital. And looking back, we feel that that was the right choice at the time because what it allowed us to do is develop dedicated care teams, care pathways, and learn as the rapidly changing information was requiring us to change in a rapid way. And we did that in a very focused effort at Bay Park Hospital to provide care to the patients who were in greatest need at that point. Since then, we've been able to take those lessons learned and push them out into all of our other hospitals so that we're using the same methods, the same pathways, the same algorithms, the same treatments that we were in Bay Park to all of our other hospitals in the same manner. And I think that that's been reflected in our outcomes by having lower than national and local averages in our mortality rates, lower days on ventilators, and lower days in the hospital total when you look at the comparisons. In the end, what this all means is that we need to continue to play a role as partners with our community, partners with the health department, and partners with our other healthcare providers in the community. And this goes both ways. So we are dependent upon those entities as a healthcare system, just as we rely on support from the community to be able to support the efforts as well. So as we're seeing these numbers go up and we don't like the trajectory that we're going, it's even more important to continue to reiterate all those things that you've heard 1,000 times over and stress the importance of personal protection and preventative measures. It's more important now as we see how steep this curve is going up with new cases to remember that wearing a mask, washing your hands, and watching your distance is these are all methods that have been proven to reduce transmission of disease and lower the disease prevalence in our community. And we, literally plead with all the community members out there to take these minor inconveniences very seriously and help us keep people out of the hospital so that we can continue to provide care to not only our COVID patients, but those patients who need it for all the other reasons that we routinely provide healthcare, patients with heart conditions, kidney conditions, lung conditions, and those things that require hospitalization. So this is a reach out to the community for support and to continue these efforts because we really want to continue to support suppress the amount of COVID in our community. And we want to look back and say, you know, we saw an increase, but we reacted and we did the right things, and we're now in a better position than we could have been. So thank you all for your time. Thank everybody who's given their support, and thank you for the attention that you're giving us this time to share our story with the community.
Dr. Kaminsky, thank you so much. And just a couple points to tie this together. The community need to hear what Dr. Kaminsky just said, but also this goes throughout the other hospital systems. We took lessons learned and we improved upon our treatments. We improved upon our process in the community. So the community needs to understand that our hospitals are prepared. They've taken those lessons and implemented all the hospital systems, not just ProMedica, not just UTMC, but they all did. I know that for a fact. And I think something else that is important for the community to understand too is that if we don't have our medical providers safe, secure, mentally fit, and understand that their families are taken care of, they're not gonna be able to respond to us. And that's disaster 101. So Dr. Kaminsky, thank you for those outstanding words and that great message. I do appreciate that. Next, Jill Trozen from McLaren St. Luke's. Are you there? Are you up there? Hi, Jill.
I am.
Good morning. Good morning. Jill,
Good morning.
please take this away and let's hear what you have to say.
Okay. Well, thank you so much for everyone working together and who's participating on this today in getting the message out and getting information out. I want to touch on the symptoms, COVID symptoms. I know that you've heard about these symptoms many times, but I think it's just always a good reminder in terms of what are we seeing out there. The symptoms can be seen anywhere from approximately 2 to 14 days after an exposure. And those include could be a rise in temperature to varying degrees, and chills, cough, shortness of breath, fatigue. People describe tremendous amount of fatigue, muscle or body aches, loss of taste or smell, and it's a new loss of taste or smell, more of an acute onset, a sore throat, nausea, vomiting, GI symptoms, diarrhea, and when, you know, people will describe varying levels of trouble breathing, or that persistent pain or pressure in their chest, new onset of confusion or inability to wake or stay awake, that they just can't seem to even be able to stay awake for any period of time whatsoever. The fatigue can be that severe. And bluish lips or face. So it really runs the gamut. And I think you just don't want to ignore any symptoms that you have and think that, oh no, this couldn't possibly be the case. You might not be aware of an exposure, and then not start feeling good. And if that's the case, you don't want to go into work or expose other people. So, you know, seek help, seek assistance, take care of yourself, but minimize any exposure at that point. So we are definitely seeing varying symptoms. And I think we've learned a lot over a period of time. We didn't know a lot when this first started, and that we, you know, were screening for temperatures and thought that that would be, you know, one of the key indicators, but it isn't always. And so we really broadened our idea about what were the presenting symptoms that people had when they come in. And we saw people come in with, you know, minimal symptoms and then deteriorate rapidly too. So you just never know. And, you know, you just want to be very careful, take very good care of yourself and you know, those around you. And as Dr. Kaminsky mentioned, in terms of prevention, very definitely, what you've heard before, but make sure that you're masking, you're washing your hands, you're limiting exposure, that those are the important things to continue to do. And I think, don't, wherever you're at, just, make sure that you're wearing that mask and, being very aware of your surroundings. And I think, as was mentioned before, people, started kind of backing off from some of that and being around more groups of people. And then we saw some spiking. And so again, if you have to be in any kind of group, limit the number of people that are there. That distance, that's at a minimum 6 feet apart. That is all extremely important, and will help with prevention methods in terms of continuing to protect everyone. And it protects you, it protects them. As Dr. Kaminsky mentioned, when you're in the hospital, we're protecting one another. When if you have to go into a work setting, it's really extremely important that you are, using all those safeguards. And I know that we were actually, I was involved in a discussion just yesterday about, just taking a break for lunch and being very careful about that social distancing during your lunch periods. Don't let your guard down. Make sure that you have to obviously unmask to eat, but make sure that you are then practicing social distancing so you don't have an exposure. And then with regard to testing, we certainly have availability of testing in our community. And, or if you're symptomatic, our physicians, your physician may order testing. Testing is available through drive-through, and in some cases, you can go in and be tested. So there's definitely various sources of testing in our community. I know that in the beginning that it was more limited, but we have many opportunities now. And so, if you're concerned, you certainly can go to various sites and be tested. So we've learned a lot. I appreciate that in this community, we have all worked together to help one another to get the same message out, to approach care in this, same way so we can be consistent. So that has worked well, and there's a very, very much a community spirit in our approach to care here for COVID. So thank you.
Jill, thank you so much. Just a quick question, just so the community understands. Do I just have to have one symptom, or should I have multiple? I mean, is this disease? Do I need all those symptoms to say have COVID, or could it just be just one of those?
Oh, it's a great question. And no, you do not have to have all of those symptoms. It can be very limited, and it can be mild. I think we're hearing and seeing very mild symptoms. And so that's a great question in terms of, don't think that you have to have severe symptoms or all of those symptoms in order to have COVID. It can be very mild. And so I think that's what's confusing too, is that, you can have a very mild case or it can be very severe, and it's not predictable.
And that is the tough thing about this disease.
Yeah.
That it's nefarious, and it doesn't follow a real good pattern. At least we haven't seen that yet. So Jill, thank you so much. Please stay on. I'm sure there'll be some questions here. Next up is Dr. Casey from Mercy Health. Doctor, hello, sir.
Good morning.
Please take it away.
Well, thank you, and thank you for allowing me to participate in this group. Well, I'd just like to start off by saying 2020 has been anything but boring, and by all intents and purposes, it's not going to turn boring anytime soon. We have seen that our numbers are increasing in Lucas County and in our communities outside of Lucas County, and Defiance, Tiffin, Willard, and all the surrounding areas. Our number of COVID cases are going up, and unfortunately, along with those increasing number of people testing positive for COVID, our hospitalizations are increasing as well. And that's, if we remember back in March, we were all very concerned about, would we have enough beds? Would we have enough testing capacity? Would we have enough PPE to take care of all of our patients that we needed to? And fortunately, the community and the healthcare systems have responded very well. And we are in very good position right now with our testing capacities and our supply of personal protective equipment. What we are finding is most precarious right now is our workforce, our caregivers. And when I refer to that, I'm referring to our environmental services personnel, our lab technicians, our dietary people, our nurses, our respiratory therapists, and our physicians. In most communities, healthcare systems are one of the largest employers, if not the largest employer in many of these communities. And as COVID patients and COVID testing turns more positive, proportionally, the healthcare workers are going to be infected as well. And so our biggest concern right now is not the physical beds or the physical equipment, but do we have the ability to care for the patients? And it's not just COVID patients, as has been mentioned. Although COVID is hit the press and is certainly what captures most interest for people, people are still having heart attacks. People are still having strokes. People are still having illnesses that require hospitalization with and without COVID. And we need to be able to take care of them. So as the percentage of the population increases, our healthcare workers infected with COVID or potentially exposed to COVID increases as well. And what we're finding is that most of the healthcare workers who are becoming ill are not being exposed to it or contracting it in the hospital or in our facilities. We have been dealing with infectious diseases in many cases, many of our facilities for more than 100 years. We know how to protect our staff and protect our caregivers and protect other patients. But the majority of our healthcare people who are being exposed and coming down with COVID are being exposed in the community, and then they're bringing it in. So as has been mentioned already, I would just like to reiterate the responsibility we have as members of a community to try not to pass on this infection. And unlike the flu or other infections where you start to feel ill about the time you become infectious, COVID doesn't appear to be that way. It appears you can transmit the disease long before, days before you feel ill. So if you know that you've been exposed, if you've been around someone who potentially has COVID, we ask that you just be responsible and do the quarantining, the inconveniences. Don't go out. Avoid crowds. Avoid places. Do the hygiene. Do the physical distancing, the masking that we've all been asked to do. Recognizing that someone with COVID, even before they're aware that they have the infection, can spread it to 2, 3, 4, 5 people. And you may not know that the person you're next to and is a healthcare worker. And so simply spreading it to 2 or 3 people might mean that there's 10 or more people who don't have the ability to be cared for in their local healthcare facility, at their local hospital, or be seen by their local physician or provider because the healthcare worker or the caregiver is ill. And so that's something that we need to be aware of, I think, as a community, is our responsibilities to protect those around us. We all certainly have our individual rights, And certainly I don't want to get into the argument. Unfortunately, this discussion has become less about infectious disease in many cases and more political. And that's unfortunate, because this is infectious disease, and this is our ability as a community to provide health care for those who need it, both with COVID and without. COVID doesn't discriminate based on anything other than are you able to catch the disease? So that being said, along the same lines, another thing we've noticed about COVID as it's stretched out longer is the psychological effects that it's had on our caregivers and on the community. In the beginning, it was a rallying cry, and many people got together, and communities donated PPE and meals and the things that were talked about earlier by Dr. Kaminsky and others we're all well aware of it. We've all been so fatigued by COVID. And the longer it's gone on, the more fatigued we have become, that it's really wearing on everybody. We have spent a lot of time in our meetings and with our incidents commands trying to support up our caregivers and talking about self-care. And self-care is not selfish. Self-care is necessary. It's much like being on an airplane where we're asking our caregivers, when the oxygen mask drops down, put your own mask on so that then you can help care for others. We need to help our caregivers, and we need to help our healthcare providers deal with the stress that goes along with caring for these people who potentially have this infectious disease that could potentially be taken home to family members. The physical distancing is damaging for healthcare workers as it is for everybody from a psychological perspective. That's why many of us don't like to use the phrase social distancing. We don't want people to be socially isolated because we need each other more than ever. We use physical distancing because we want to keep the distance apart, but still be able to interact with each other. The longer this pandemic has gone on and the longer the COVID has been an issue, the more depressing it has been for many people. And we have seen that. We know that depression is up. Abuses of all sorts are up. Suicide attempts are up. It's really been affecting the community and our healthcare workers. So a big concern, not only from the physical and infection prevention, is how do we take care for people? And that's, again, something we can all do. When the weather was nice, we could all get outside, go for walks, do things. And now that the weather's getting a little bit less hospitable for outside activities, I would ask that everybody continue to reach out to your family members, your friends, your community members, anything you can do in a responsible way to help them and help all of us, not only to isolate the virus, prevent and minimize exposure to the virus, be the best stewards of the resources we can, but to protect and preserve the physical and emotional health of our healthcare workers and the people in our community. It doesn't appear to be going away anytime soon. And the monitoring that we're doing right now and that what we've seen over the past few days suggests that it's actually increasing again, and it will probably get worse before it gets better. And as unfortunate as is, we're prepared from a supply and a readiness approach. We just need to make sure that we have the people who are both physically and emotionally capable of caring for those, both with and without COVID. On the horizon, one of the things that's coming up is what we can be hopeful for is it does appear that the vaccine will be released in a few months. Like we learned early on in this pandemic, we're not going to have enough of what we would like to have in the beginning. There is going to be an approach where frontline at-risk healthcare workers probably receive it before some others, and those who are in congregate living and high risk. And there will be a stepwise approach, a phased approach as to who gets it, as to when. So when the vaccine first comes out, it doesn't mean we will be capable to stop doing these other, as Dr. Kaminsky said, minor inconveniences to help protect each other. But the vaccine is on the horizon. And if there is anything that can be said, fortunately, about this, the fact that we are doing the flu vaccine right now is just putting all the processes in place so that when we do get the vaccine, we will know and have the processes to as smoothly provide the vaccine to the community and those people who get it in that phased approach as efficiently as possible. So as everybody else on this call would ask, our big ask is be responsible. We know it's not pleasant. We know this is an inconvenient. Our life has been disrupted in 2020 like nobody would ever have predicted. At many of us, I don't think any of us in our lifetime have ever seen anything like this. But we just ask that we continue to protect our healthcare workers, protect our community members from a physical perspective, from an emotional perspective, from an infection prevention perspective, so that we can continue to provide that safe, high quality healthcare for everybody with and without COVID. So thank you. And Eric.
Dr. Casey, thank you so much. Excellent points. Just real quick, it appears to me that our biggest tool, our best tool, is our medical providers. It's the medical staff, and we have other tools to again, if you would, treat COVID. However, can you just circle back around just real quick? Can you talk about quarantine and isolation, how really that is the frontline protection for our hospital systems? I know you talked about it a little bit, but just a couple more words on that, if you could.
Sure. So we know that it's infection that's spread through respiratory, through droplets, through sneezing, coughing, through breathing. So two things: one, proximity, physical proximity, and the amount of time you're exposed to someone who has the virus. It increases your likelihood of contracting it. Now, some of it's transmitted by touching on substances where someone has coughed or left the virus, but that doesn't appear to be terribly long lasting. So if we are maintaining our appropriate physical distancing, if we are not exposing other people, if we are exposed or we are in fact infectious, and if we are limiting our ability to receive it from somebody, that is the best way to prevent the transmission, hands down. If the virus can't go from one person to another, we know the virus lasts for a few days, a week, maybe two, on the outset. So if the virus can't be transmitted from one person to another, the virus dies. And then if we do the appropriate physical isolation, if we do the appropriate distancing, if we do the appropriate masking, and just do everything that we can as responsible members of our community to not spread it and not put ourselves in situations where we might receive it, because it appears that 20% of the people who are spreading it aren't even aware that they have it and develop mild or no symptoms. So just because you feel well doesn't mean you're not at risk for transmitting it. And just because you're with someone who feels well doesn't mean they're not at risk for giving it to you. So the best thing we can do is appropriately keep our distance, appropriately mask, do our hygiene. And if we do that diligently, if we are incredibly disciplined about that, then the virus becomes much less of a concern for us.
Doctor, thank you so much. I really appreciate that. Next up is Dr. Ellis from the University of Toledo Medical Center. Dr. Ellis.
Yeah, good morning, Eric. Thanks for having me on this meeting, and thanks also to my colleagues. It's a pleasure to be able to participate. I think it's interesting that we're collected here as a group of healthcare professionals, and I think that it mirrors as a community what's really going on a global stage, which is this interconnectedness of that the uniqueness of a once in a century kind of global pandemic. It really brings out how interconnected we actually are as people, and what we do individually affects everyone. So that really no man or no person is really an island. I was asked to talk a little bit about influenza vaccine, and Dr. Casey mentioned that already, but I think that what I'd like to say about it is that, and it kind of ties in with what both Brian and Kevin have already said, is that, people are fatigued, people are anxious, they're concerned about their loved ones, they're concerned about themselves, and that fear and that anxiety, it weighs on people. But I also think that we should take heart, because at the end of the day, we're really not completely helpless. There are some proactive things that we can do. it's already been mentioned about the physical distancing, the wearing the masks, the staying home when you're ill, hand washing. Those are all positive actions that people can take to protect themselves and their entire community. There's another thing that we can do, and that's flu vaccines. And so, people will say, well, why should I get a flu vaccine during a COVID pandemic? That's a different virus. Well, and it's been touched on already, and that is the importance of what a flu season normally does for a healthcare system. So in any given year, and flu season starts usually in November and can go all the way through May. They usually peak sometime between December and February, but we measure those illnesses in millions, and we measure hospitalizations from influenza in hundreds of thousands. So if we are already experiencing hundreds of thousands of hospitalizations for COVID, and you pile up on top of that the addition of another 100,000 admissions to the hospital into a healthcare system that's already stretched thin, and you can see where instantly that's a problem. And it's not just the hospitalizations that can overwhelm the system. It's the people coming to seek care from a healthcare provider, urgent care, or emergency department. Influenza is a respiratory virus, and the symptoms to distinguish the symptoms between COVID and influenza is really impossible. They're going to present in a very similar manner, and so only special testing is really going to distinguish that. So you can see that if you have lots of people coming in with COVID, you have lots of people coming in from influenza, then it automatically becomes more complicated to sort out who's got what, because the treatments are not the same. So how can we help protect ourselves, our loved ones, and our healthcare system in our community, in our state, in our nation, globally? Flu vaccines do that. So, every year a new concoction is probably not the right word, but every year a new formulation for flu is developed, and that's based on what's anticipated to be the predominant viruses in that flu season. So this year there's a formulation that, and most vaccines contain 2 flu A viruses and 2 flu B viruses. And those are the viruses that are most likely to circulate this season. And each year, it's not always a perfect match, and it may not prevent somebody from getting the flu. However, what has been clearly demonstrated is that although the flu vaccine may not prevent an individual from becoming ill, when you look at a whole society, it reduces the number of severe illnesses, reduces the number of hospitalizations, and reduces the amount of healthcare expenditure. So by getting a flu vaccine, you are essentially protecting yourself, protecting others, and then protecting the system so that it's not creating an added burden onto an already beginning to peak COVID pandemic. So I look at it as a duty, really, that a duty to yourself, a duty to your loved ones, and if you're a healthcare provider or a first responder or people who are around immune suppressed people or the elderly, it's a particular duty to because by doing that, you're protecting them as well. Who can get a flu vaccine? Basically anyone over the age of 6 months. So 6 months old is the cutoff for a flu vaccine. And that's why parents need to get vaccinated to protect the child who's younger than 6. And then pregnant women are especially at risk for severe influenza, as well as folks older than 65 or whether they have any underlying immune suppressing conditions. So again, I think people should take heart and say, hey, what can I do for myself, my loved ones, my community, besides all the practices that we've mentioned, and that is to get a flu vaccine. So that's what I'd say about vaccines. I was also asked to talk a little bit about the COVID-19 vaccine development. So it's really been quite remarkable, and I think that the program that basically oversees it, Operation Warp Speed, is really kind of an appropriate a title for it. And so what Operation Warp Speed is intended to do is to bring the Department of Health and Human Services, the Department of Defense, and the private sector together to be able to develop a safe and efficacious vaccine by the end of 2020. So we're approaching the end of 2020, and right now there are 4 vaccine candidates that should be wrapping up their phase 3 studies by either the end of November or the beginning of December. So it's depending on what the efficacy data shows and the safety data shows, we could very well have a COVID vaccine by the end of this year. The other thing and so Operation Warp Speed, really it began vaccine development in January. So as soon as the outbreak had been identified in China, investigators had access to the virus and its genetic material. Were able to start vaccine development as early as January. Phase 1 studies, which are measured in usually dozens of people, had started in March, and then by July, phase 3 studies had started, and those are measured in tens of thousands of people who are in those studies. And so those studies that started in July should be wrapping up again with data that can be actionable by the end of November or sometime in December. It's also been reported in the news that several of these have had to be paused for safety concerns. That's not unusual for a vaccine, and vaccine development usually involves data safety monitoring boards that carefully look at safety endpoints to make sure that the vaccine's safe. So I think we shouldn't lose heart when we hear that something's been paused. The other thing about the vaccine development program with Operation Warp Speed is that instead of doing this vaccine development process sequentially, which can take years to come from the basic science to a vaccine that goes into people in widespread use, instead of doing this sequentially, they've done this in parallel and also developed, even while the vaccines are in phase 3 studies, they're manufacturing them at scale so that there will be tens of millions of doses available when it's time to deploy the vaccine. So I think we should, we should be cautiously optimistic that we have a vaccine by the end of the year. At the same time, we should be realistic and anticipate that even with a vaccine, we would still be practicing all the same things that we do with physical distancing and wearing masks. I don't anticipate that this is going to end anytime soon, and we have to be resilient and recognize that we're in this together, and everyone should do his or her part and look after your neighbor.
Dr. Ellis, thank you so much. That was great. Got one question for you. So I get questions all the time here at the health department. We get questions all the time. I don't want to get a flu vaccination or any type of vaccination because it causes autism. Can you just quickly speak on if that's true, not true, some of the basis for that misunderstanding?
Yeah, so that is absolutely not true. To talk about the untruth of that, and that whole story is itself a whole hour-long tale. Suffice it to say that it's not the case. It's been clearly demonstrated in very large, robust studies that these vaccines are safe and effective. There are very few contraindications to an influenza vaccine. And you can get a flu shot at local pharmacies, at your primary care doc, and the health department has locations, and then also some, if I'm correct, has some outreach programs where you can get a flu shot too.
Doctor, thank you. Excellent. Okay, so I'm going to kind of bring us home a little bit here in the sense of, I want to give an update on Halloween. We are having the ability for trick-or-treaters this year, which is good, but we really need to take it upon ourselves with our children, but also then if we're passing out the treats this year, to really understand that it's not typical like we've done in the past. Just a couple things for the little ones. Don't allow them to reach into a bowl and grab candy. The individual who's passing out should actually drop it into their bag or into their container. You should physical distance, stay 6 foot away. Don't spend time at any one house. You could say hello, but move on. Go ahead and enjoy the night as a trick-or-treater should. But again, we want to limit the amount of time that we're at any one house. We don't want to have that physical contact. And again, don't be reaching into bowls and things of that nature. Make sure that, again, that the individual who's passing out actually drops it in the bowl. Also then too, I'm going to actually make sure that I have hand sanitizer for myself, but anybody else who wants it there as well too. So it's just a couple things that we can do. The bigger concern that we're going to have, I do believe, is us adults. Again, we as adults love Halloween just like anybody else, and we love to go to parties. But again, please understand that you are taking a risk by, again, attending those parties. But you're also then to potentially affecting our community, because if you do get COVID at the party, you could then again cause a community issue. So if you're holding a party, again, limit the number of people, stay social distances or physically distance as much as you possibly can. All the things that we've talked about today as well in the past. The big thing though is maybe make that decision to forego that Halloween party this year. And again, let's save that till next year, till I think we're in a better spot. Again, holidays are great, and again, they're going to be different this year, but we're trying to do some things to help out the community. Again, much like our hospitals and all those individuals that we heard today, just amazing individuals, and they're doing the right things. And the entities in the hospitals themselves are doing everything they possibly can. So again, your elected officials are engaged. They're trying to do as much as we possibly can to make sure that, again, the community is safe. And there is a program that we're just able to launch here within the last 24 hours or so. We've gotten some additional face coverings and face masks for the community. So every jurisdiction is going to be able to get some face masks for the community for Halloween use. Hopefully we can get them out quick enough. But again, we have Election Day coming up too. We're going to want to have face masks out there. But then, of course, there's, Thanksgiving and Christmas, the holiday season's coming up. So we're going to try to get these face coverings out to the community. And again, can't say enough about our elected officials and as much as they're trying to protect each and every one of our communities. So again, we're trying to make sure that program gets off the ground ASAP. So hopefully we can get those out before Halloween. Just some closing remarks, and then we're going to do question and answers. Again, this was really important for the community. You heard the issues inside the hospitals. You've heard of the same things we've been talking about symptoms, but we're going a little bit more in depth possibly. You heard about the flu vaccine and making sure that, again, we don't add to our issues inside of our community. I want to speak to those individuals who might not think that COVID is that big of a deal. They really don't want to wear a face covering. They don't physically distance. And maybe COVID won't be a big deal for you. And if you're infected and then you expose somebody else, and again, somebody else is exposed. But make sure in the back of your mind when, again, you think you shouldn't wear a face covering, or maybe I could go to that larger party, that you could be influencing their ability for our medical system to respond to maybe you having an issue such as a heart attack, or a loved one having a heart attack, or a friend having a heart attack. And again, just think about that before you don't want to wear that face covering, or that you want to go to that large party or that backyard party. So again, think twice and make sure you take it upon yourself to protect the community and do the right thing. I think with that said, question and answers. I think, Shannon, are you going to take care of this, or do you want me to?
I can do it.
All right, thanks. So go ahead and if you would, let's see, get the gallery view here. Does anybody have any questions for our panel today?
Hi, Eric. It's Melissa Vage from 13 ABC.
Hi, Mel.
Hi. I wanted to get a pretty succinct answer about a vaccine. And I was reading a report this morning that said that we're looking at probably the third or fourth quarter of next year, 2021, before we are seeing mass vaccinations. So I would just maybe Dr. Kaminsky or Dr. Casey could address that, please.
Sure, I can start, and then maybe Dr. Ellis might be able to weigh in as well. He would probably be our best expert on that subject. I'm going to phrase maybe a little bit differently what he talked about with that parallel development. Usually with vaccine development, there's a lot of sequential steps, and what several large companies are doing right now is they're all working on their own vaccine, but the steps are being taken in parallel rather than in a sequential approach. So that is investing a lot of resources for a product that hasn't been proven yet. So as hospitals, we're getting notifications that come up by way of the federal government through the state and then into our local health department on actions that we need to do to prepare for deployment of the vaccine. So we're already starting to put into place scenarios where prioritizations are created, and we vaccinate the highest priority groups first, and then move our way through eventually the entire community and the entire country once a safe and effective vaccine has become available. But the way that these companies are doing their trials is that they're using double-blinded randomized controlled trials. So when a study is done like that, both the recipient of the vaccine and the researchers don't know who gets placebo and who actually gets real vaccine. And it's really important to protect the integrity of that as the vaccine is developed, so that truly nobody knows who's getting what, so that there isn't unnecessary bias that goes into this. And because of that robust process, there isn't any good information being released, and that's appropriate, on whether or not these vaccination trials are effective. We're only going to know that when the data becomes unblinded. And so we're working in parallel, and if they are proven to be effective, then those dates can be earlier rather than later. But we truly don't know exactly what the results are yet, and that's the right way to do this, so that when the data gets unblinded, we're going to learn more, and those type of pieces of information are going to help the people running these trials declare when an appropriate start date would be. So we're working on distribution. We're working on developing our own internal policies so that when it is declared that we have a safe and effective vaccine that is ready to be distributed to the public, that we've already hit the ground running and we're ready to distribute, rather than to just start those steps as would be done historically. So I'll pause there because sure others have more information on that subject that may more directly answer the question.
So Mel, I'll just jump in here. The state has a tentative plan right now. The federal government has ordered about 3 million doses initially. And from what it appears, it's going to be a two-stage vaccine. You need to get it, and then you get a second dose later. 3 million doses from, I think, 7 different producers is what they're thinking, or manufacturers is what they're thinking. You can tell that first order is about, in a population of what, 331 million or so, that's about 1% of the population. So the state has a plan that when it comes in, it goes to a distributor who packages it and sends it out within 24 hours. And then there's a four phases of determine who gets it when. And my guess is, depending on how quickly the vaccine is released, how much we can get of it, those phases might overlap. But based on risk of exposure, this is not my words, but how critical or necessary you are, or what your task is for the community and for the public good, your comorbidities, your risk factors of having a bad outcome from infection, that will determine which phase you fall of those 4 phases. So while some might get the vaccine as early as January or February, the mass vaccine for everybody who doesn't have risk factors, everybody who in that 4th phase probably will not be till the 3rd or 4th quarter, simply because of production capabilities and restrictions.
Thank you.
Is that good, Mel? Okay, thank you. Other questions? Anything for
Dan? Go ahead, please.
Yeah, this is Dan Rutt from WAKT 106.1 FM. I have a question for Dr. Ellis. First, I'd just like to thank UTMC for developing the laboratory capability. And it's my understanding that your labs do a fair amount of our local testing. My question relates to the fact that our current positivity rate is over 15%. And since that is desired to be under 5%, we're kind of jammed up even at this point while we're in a steep rise. So my question is, does UTMC have plans for expanding testing to make more testing available? And in as much as we're limited, what are the bottlenecks at this point?
Thank you for the question. Testing at UTMC right now, and I think that this is the case for all the hospitals in town, we screen patients, all patients who are being admitted to our hospital. We screen all patients who are going to have an elective surgery. But the other thing we do at UTMC is we're also doing the testing for the main campus right now. The bottlenecks are, interestingly enough, people. So having the number of technicians we need, having the supplies, and then having the equipment. Right now we have plenty of supplies. We have healthy people to be able to run our tests, and we have the equipment. So right now our focus has been obviously on the patients in our hospital, but it's also to help support the overall university mission in keeping the students safe and the faculty safe. I hope that answers your question.
Yeah, as a follow-up, can you talk about the surveillance testing that's happened at the University of Toledo? I noticed in the most recent week, you added in testing, I think from Quest Diagnostics, that was doing testing among athletes at UT. And just like what have you found with surveillance testing? And if you could also just talk a little bit about why you're putting those 2 data sets together when you're trying to get a generalizable, rate in the community, in the UT community.
Yeah, so those are good questions. I do not oversee all the testing for the students nor the student athletes. The student athletes are tested by Quest, and that's because the testing is much more frequent, and I believe has to do with the Mid-American Conference and their protocol. So I am not an expert, and I probably can't answer a good question there. To answer your other question about positivity, it's true. You do want to be able to know who are your asymptomatic folks and who are your symptomatic folks. Those are different groups of people. And as Dr. Casey said, 40% of people can be walking around asymptomatic. And so when we screen people who are asymptomatic prior to procedure, we have a relatively small percentage of those who end up testing positive, and it's really only 1 or 2%. But that's what I would say.
Thank you.
All right, anybody else? All right, I am seeing no other.
Carly has a question.
I'm sorry, who does? I'm sorry.
Brian, do you want to go first?
Oh, I'm sorry.
That's okay.
Hi, my question is actually for Dr. Casey. You mentioned the importance of keeping healthcare workers safe and unexposed. Are you seeing a significant number of healthcare workers at this point who have been infected or exposed? And is that causing problems with treating people?
So that's a great question, and thank you for that. So I guess the first thing to do would be define significant. And in my opinion, yes, it is. And it doesn't mean that there's a large number, but it does mean that we have to be very careful. And sometimes we've had to share resources, particularly our staffing, from one facility to another. Fortunately, we've been able to do that. And in some cases, we've had to postpone some procedures or move a procedure to another facility. We've been very fortunate. We have kept, as far as we know, no COVID patients have been admitted to our Perrysburg hospital. So we've been able to keep our staffing there and do what we can do there. But as I mentioned earlier, a single healthcare worker a caregiver being ill can affect the ability to care for 10 or more people, depending on how long they are ill. And so the answer to the question is yes. In my opinion, 1, 2 healthcare workers being ill with COVID is a significant number, because it does affect our ability to efficiently and effectively care for people as we would like to. It's still safe. It's still high quality. We're still doing what we need to do, but we've had to be nimble and flexible like everybody else has. The answer to that is yes. Not to a point where it's affected our ability to care for our community. But again, our people are not being infected, as far as we can tell, in the hospital. They're bringing it from the community. And as the numbers go up in the community, my big concern is that the number of healthcare workers who are exposed and infected will go up as well. And we would really like that not to happen.
Thank you very much.
Okay, Kaylee?
Can you hear me?
Yes.
Okay, my question's for you, Eric. As we've seen, the virus increase over the last couple of weeks, Governor DeWine earlier this week said that he doesn't plan to institute any, new orders or closures. But in our community, is that a conversation you guys are having? We've urged people to kind of buckle down right now to prevent this, extra spike again. Is that anything you guys are considering, new recommendations for schools, businesses, orders at all?
Yeah, Kaylee, every day we get together with staff and look at the situation for that day. And we're trying to project to trend analysis and things of that nature to see out where do we need to go. Where I'm in contact with, multiple different agencies Matter of fact, right now, superintendents are meeting to discuss current conditions within side of Lucas County. So long story short is that, we have to take information and, we have to use data to get us to a point where do we need to be with, let's just say, I don't want to say closures, but things that we need to do differently. We've talked to the schools too, about their current conditions and, do they need to go virtual right now because we're red? And right now we're not seeing in-school transmission. So the point here is we need to make decisions on what we're seeing in our community. If we do start seeing in-school transmission, then, we're gonna have to make a recommendation to maybe do something different, maybe go virtual hybrid for some of those schools. So again, it all depends on what's going on at that point in time. It's all scenario driven. The idea of closing bars and restaurants, again, I don't think we're anywhere near that decision. That those are discussions, but you're plainly heard from the governor is that, can we really afford to shut down again? And I think, I'm sure those discussions are happening, even though he's saying that, we really can't afford to, but there could be a situation or scenario where, we need to do some additional things to postpone or cancel. We do here locally have plans that come in for different types of activities. And those are all then, whether it's a craft show or something along those lines, again, those are all individually looked upon. And at that point in time, again, scenario driven, whether they should go on or not. So those types of things are done every day. Thank you. All right. So Melissa, do you have another question? No?
Yeah.
Okay.
No, I was just gonna, obviously the governor will have his news conference. What do our numbers in Lucas County look like? Can you give us a preview of what we'll be seeing? I assume we're still in red because you have to stay there for a while, but are we making any progress? Are we going up even further?
Well, let me look. Since I've been on here, I haven't looked at my emails. I see no additional concerns with going to purple. So that is a good thing. Hang on here one second. Oh, nope, we're going to remain at level 3 for today. Here's our current numbers. Actually, yesterday we were about 162 per 100,000. Today, when I looked, I think we're around 158, give or take a little bit there. But that doesn't mean anything. Just because we dropped over a day doesn't really mean anything. We still have a high instance. We're above that 100,000. I just got information about our daily count. We're around, let's just say 60 per day. We had some high days here last couple days of reported illness to us of 70s. So again, can we say that we're coming down? No, we're going to have to take a couple days here to look at that trend analysis and see where we're at. As you know, Melissa, that again, it's just a snapshot in time. We do have to see numbers come down or go up to really make a good decision of what's happening. I think the bottom line here is, we're not here today to cause any fear. That's not our message today. This is truthful. These are factual. You just heard the numbers that I told you. They're what we have. Our conditions that we're going to see probably as we go in the next couple of weeks, they're going to not really improve because we're going to get into flu season and we're going to be cooped up with each other. So again, today's message is nothing about fear. It's just facts that we're trying to give the community. It's really real life issues that we could face. So again, those numbers, we'll look at the trending, and as you know, we'll report out as if we start to have some issues. All right. Anything else? Okay, I do not see anything else. Just some closing remarks, just real quick, is thank you very much. Again, it was a hour and 20 minutes that we had with some great professionals, some exceptional individuals, again, some great healthcare systems. And I really want to close by saying, we need to be concerned about COVID, but understand that our hospital systems, as well as the multitude of other organizations, are as prepared as they can be. You heard that today. We have resources. Yes, our most important tool and our asset, those individuals that take care of us, that is a concern. And again, I urge the community that to offset those concerns is to not inundate our hospitals with COVID patients And the way we do that is take it upon ourselves to do the right things, to think ahead, and to understand that if we don't, as individuals, take those necessary steps, we will have issues inside of our hospitals because we caused it. Hospitals didn't cause it. We did by not taking those precautions. So again, I don't see any other questions at this point in time. So with that said, thank you very much, everybody. Thank you, our panel. Again, exceptional. And again, we will keep you posted in our community what's happening. Thank you.